So first is to review the patient's case. The patient is in her day 3 postpartum from a normal delivery. Prepare the equipments to be used to save time and effort. And do a proper hand washing. Enter the room with courtesy. Hello, ma'am. I'm Jimbert Alikino, a student nurse from VUPC, and I will be your student nurse for today. And provide privacy. Ma'am, I will be assessing you using the BUBBLEHED Assessment to check if there are infections or abnormalities. Hawakan ko po ma'am yung private parts mo. Okay lang po ba? Next is to take the history taking of the patient. The age, gravida and priority, history and types of delivery, familial history of medical illness, surgery history, medical history, allergies, medications, or maintenance drug abuse, alcohol intake, smoking, educational level, socioeconomic status, and support system. Put gloves and mask on. First is to assess the breast. Assess the supply and latch of milk transfer and pain due to engorgement, and assess for signs of infection, fever, and erythema of breasts. Assess for cracked nipples, pressure sores, or fissures. Ma'am, kumusta naman po ang dede mo? May nafe-feel ka po bang kakaiba? Nakakadede na po ba yung baby ng maayos? May lumalabas na po bang ang gatas? So the documentation for her breast is the nipples are inverted, there are no crack or lacerations found, and the production of milk is normal. Next is the uterine and fundal height. Explain the procedure and rationale before beginning the procedure. Ma'am, i-check ko po ang uterus ninyo para malaman kung may abnormalities po ba dito. Assuming that the patient has already voided, place the mother in the supine position with her knees flexed. Place your non-dominant hand above the woman's pubis in a cupping manner. Then press in and downward with the other hand at the umbilicus until she makes contact with the hard globular mask. Use the flat part of your finger for palpation. Begin palpation of the umbilicus and palpate gently until the fundus is located. If the fundus is difficult to locate or is buggy, keep the non-dominant hand above the woman's symphysis pubis and massage the fundus with the dominant hand until the fundus is firm. The non-dominant hand anchors the lower segment of the uterus and prevent inversion while the uterus is massaged. Identify if the fundus is above or below the level of the umbilicus. Use your fingers to determine the number of finger breadths between the fundus and the umbilicus. One finger is equivalent to 1 centimeter. Day 3 postpartum. Uterus is firm and contracted, located at the midline of the abdomen with 3 finger breadths below the umbilicus. Encourage patient to void with her first hour postpartum. The bladder should be palpated above symphysis pubis every after voiding to assess urinary retention and record the first 2 voidings. Be alert for signs and symptoms of UTI. Bladder is not distended, able to urinate 5 times of amber-colored urine, 1,500 cc amount within the shift. Next is the bowel. Assess the bowel sound and movement by using a stethoscope in the 4 quadrants of the abdomen. The patient has a normal bowel sound and bowel movement and has presence of flatus and has no abdominal distensions. Next is lochia. Assess peripad daily for color, amount, type, and for any foul odor. Inspect for the type of lochia. The color and amount of vaginal discharge should be noted, and provide perianal care. The type of lochia is lochia rubra. There's bloody and small clots, fleshy, earthy odor, darker in color, and no excessive bleeding. Next is episiotomy. Provide privacy and explain the purpose of the procedure. Ma'am, iti-check ko po ang vagina niyo po kung meron po bang abnormalities or infection. Ask the mother to assume the seam's position and flex her upper side leg or at lithotomy position during perineal care. Lower the perineal pads and lift her superior buttock. Note the extent and location of edema or bruising. Extensive bruising or asymmetric edema may indicate formation of a hematoma. Examine the episiotomy or laceration for redness, ecchymosis, edema, discharge, and approximation. Note the number and size of hemorrhoids. No signs of episiotomy bleeding, no redness or swelling, good wound healing, and no change in approximation. Next is Homan sign. Assess for Homan sign shift upon dorsiflexion of the feet. And assess for redness, nodular or warm areas, discolorations, and leg viscosities. No complaints of pain on dorsiflexion of both feet. No signs of redness, nodular, and discolorations. Next is emotional status. Assess the emotional status level. Identify level of emotional paces and coping mechanisms. Provide emotional support and diversional activities and encourage support system. Ma'am, kumusta naman po yung panganganak niyo po? Okay naman po ba? 3 days after delivery, patient contemplated over her recent birth experience, a sense of wonderment when looking at the neonate, and verbalized about labor and birth. 10. Assess for the temperature, heart and pulse rate, blood pressure, pain and discomforts, and birth control, and prepare the proper documentation.